Speaker, Dr. Renu Hashia. She would be talking on HBOT in ophthalmology.
About hyperbaric oxygen therapy, its usage in ophthalmology, though it has not been used much in ophthalmology, but now globally people have started using in various conditions in ophthalmology also. Primarily it has been used by Undersea and Hyperbaric Society of India for decompression sickness, and in cancer patients also they are using it. So this involves breathing pure oxygen in a pressurized environment. The goal is to increase the amount of oxygen in the blood and tissues to help repair tissues and restore normal body function. So this hyperbaric oxygen therapy is a unique and modern way of therapy that taps into the body's natural healing abilities. The eye and periocular tissues can benefit from this therapy in certain disorders. The anterior chamber, posterior chamber, and the vitreous body are filled with non-compressible fluid, which means that the eye is not adversely affected by changes in pressure unless a gas space exists adjacent to the eye or within the eye which is from surgery or trauma. Now, the physiology of eye in hyperoxic condition is normally air at 1 atmosphere absolute has an oxygen partial pressure of 0.21 ATA, and it produces an arterial PO2 of approximately 100 mg in healthy young individuals. At this PO2, the hemoglobin saturation approaches 100%, and oxyhemoglobin transports bulk of the oxygen to the body. The amount of oxygen dissolved in plasma is normally only about 0.31 volume percent, but this dissolved oxygen fraction increases in proportion to the inspired PO2. Now, how does this HBOT work? In a hyperbaric oxygen chamber, the patient can lie down in a relaxed and comfortable position with a specialized hood or mask. Slowly, the pressure inside the chamber is increased 2 to 3 times higher than the normal atmospheric pressure. A specially trained HBOT technician remains in the chamber throughout the treatment. During the compression or increase in pressure inside the chamber, patient can feel fullness or popping sensation in the ears, and this sensation can be relieved by simple equalization procedures. So what constitutes HBOTs? It is the high pressure oxygen, and this is high pressure under which the oxygen, 100% oxygen is delivered in a chamber, in a closed chamber, which can have one seat, or it can have multiple chairs on which the therapy can be given to the patients. So this can be a chamber where only one patient can lie down, or you can have chamber where multiple patients can sit at a time. Now, the mechanism of action of HBOTs, this is a normal blood flow where the vessel is not occluded and it goes to the tissues. But in a compromised or when there is a occluded blood flow, what happens, that plasma can still flow through the channel, but these red blood cells, they block off the blood flow and they cannot go to the tissues. So as a result, the tissue break down due to lack of oxygen which are around that blood vessel. Now, what happens when you administer hyperbaric oxygen therapy? The red cells are not passing, but there is increased plasma which can carry up to 100% of the oxygen under pressure, and then it diffuses to the peripheral tissues where there was a restriction of the blood flow, and increased this plasma goes to these tissues, and in addition there can be an increase in the vessel. There can be extra capillaries which can grow from this, and they supply the areas which have reduced oxygen supply, and that is how it really works. So this is again showing the same thing, that once you increase the ATA, the oxygen dissolved in plasma also increases, and that is how it helps the patient. So now as far as eye is concerned, there are various indications where this therapy can be used. We can use it in decompression sickness, arterial gas embolism, central retinal artery occlusion, ocular and periocular gas gangrenes, cerebro-rhino-orbital mucormycosis, periocular necrotizing fasciitis, carbon monoxide poisoning with visual sequelae, radiation optic neuropathy, radiation or mitomycin C-induced scleral necrosis, periorbital reconstructive surgery. Also, this can be used. Many vision-threatening eye diseases are associated with hypoxia and accompanied by elevated levels of VEGF, which is a normal hemodimeric soluble glycoprotein growth factor. Whenever there is chronic retinal hypoxia, as in it can result in elevated levels of VEGF that trigger neovascularization in the retina, optic disc, and iris. Elevated levels of VEGF can also cause increased vascular permeability that can produce loss of vision through macular edema. A number of agents have been developed to block the effect of VEGF and are now being used to treat a variety of ocular conditions. So that is how hyperbaric oxygen therapy can also be used to treat certain conditions where there is retinal hypoxia, like central retinal artery occlusion, a condition that can cause permanent retinal damage, and this therapy can help restore and maintain retinal oxygenation, reduce edema, and preserve compromised tissues. It can also reverse ischemia-related damage if applied within a certain time frame. Other potential ocular indications where this hyperbaric oxygen therapy can be used in ophthalmology are again where there is ischemia or there is embolism. So these are the list of conditions where there can be use of HBOT. Contraindications are in asthma, in claustrophobia, congenital spherocytosis, COPD, eustachian tube dysfunction, high fever, pacemakers, when a patient is on pacemaker, or there is an epidural pain pump which is there, seizures and pregnancy. So in these conditions, HBOT is not given. As far as problems with HBOT are concerned, generally it is considered to be a safe procedure, but though complications are rare, but this treatment does carry some risk. And the common complications which have been encountered are middle ear injuries, including leaking fluid and eardrum rupture due to changes in air pressure, temporary nearsightedness caused by temporary lens changes, lung collapse caused by air pressure changes, which is called barotrauma, seizures as a result of oxygen toxicity, hypoglycemia in patients who are diabetes treated with insulin. In certain circumstances, fire because of oxygen-rich environment of the treatment chamber have been reported also. As far as problems in eye are concerned, patient can have eyelid twitching, blurry vision, and visual field disturbances which are temporary. Temporary nearsightedness also can occur in these patients, which is caused by temporary eye lens changes. And many of these symptoms are thought to be caused by oxygen toxicity of the lens, which can lead to complications like cataract and myopia also. So as far as visual function which is to be seen in these patients, we don't have to monitor only the visual acuity in these patients. We have to consider the visual fields also. So visual acuity alone is not an adequate measure of visual function to monitor the efficacy of HBOT. Ocular examination after the administration of HBOT should include automated perimetry also to evaluate the central 30 degrees of visual field at appropriate intervals. Interpretation of the literature on the efficacy of HBOT in treating ocular disorders is complicated by several factors. There is frequent failure to include visual field examination as an outcome measure, failure to adequately address the interval from symptom onset to initiation of this therapy, and lack of evidence for optimal treatment regimens for essentially all ocular indications. Thank you.
Thank you, madam. It's a very good presentation. And that application, real-time application. So will you like to share with us where you have given in what type of patient you used, tried in CRAO patients?
Actually, sir, in India, the use is not much. Still, we are not using it much, but certain institutes have bought the HBOT chambers, like in Delhi. They have purchased, primarily Chennai, people have started, and this Baba Research Cancer Institute.
Have you an experience of using it?
No, I have personally not used because we don't have this chamber, but I'm trying to collect the literature and so that we can, the benefit can be given to such patients where we can help.
Actually, Uttarakhand AIIMS Rishikesh has this hyperbaric, basically the plastic surgery, the surgical people, they use it. But you had emphasized on use in ophthalmology. CRAO was known to us, but others applicability, so I was looking for. Anyway, thank you very much.
They have claimed that even CRO patient can get benefit even 7 days after an attack of CRAO if the therapy is given.
Okay, thank you.